Welcome to Section 4 of the Sports PPE module. In this section, we will cover the role of the checkout provider. The role of the checkout provider is a really important part of the process of the sports PPE. Basic purpose of the checkout provider is to do a comprehensive review of both the history and physical exam findings and determine the final clearance decision in the sports PPE process. This person, whether it's a physician, a nurse practitioner, a resident, or a PA, they collaborate with the PA students and PA faculty to ensure that all the examination findings are complete and documented correctly. The provider background, again, is usually a local physician, a resident, a physician, advanced provider outside of the PA program, generally speaking. So the key responsibilities of the checkup provider are really to review the exam findings. They're going to look through all of the history, all of the physical exam, and identify anything that may be overlooked. They'll talk to the student athlete, discuss anything on the history form or on the physical exam. They also might even recheck the physical exam if they notice something abnormal, like for instance, if they hear a murmur, they might re-listen to it. And really, they're going to determine the clearance status. They'll also identify any conditions that require follow-up. For instance, a patient has poor visual acuity, they will clear them with the condition that they will need to be cleared by an optometrist with a better than 20/40 vision before resuming sports participation. They'll want to communicate any findings clearly on the documentation, and if anything is really concerning, they probably need to contact the student athlete's parent. Easy way to do that: almost every student athlete has a phone. You can have the student athlete call their parent and then discuss it with them over the phone. They'll also need to sign off on the clearance and indicate, again, any need for follow-up. So practical tips: if you as a PA student will not be the checkout provider, but just so you understand the full circle role of all the different providers or team members within the sports PPE, it's important that the checkout provider be thorough. They need to review everything thoroughly, need to double check for anything that was missed. They need to clarify anything. If something, maybe they have a history of murmur in the history, but no one documented a murmur in the physical exam, talk to the athlete and figure out if maybe something was missed, and then want to explain to the athlete what the findings were and what the status is, using simple language that they can understand, and getting the parent involved when needed. Also encouraging questions and educating the student athlete in the process. So common reasons for not clearing athletes include cardiac issues. So any new murmur cannot be cleared. Even murmurs that have been documented in the past, it's usually pretty standard for a request for a clearance note from the patient's cardiologist saying that they have had the proper workup and have been cleared in the past to go along with the patient's file. That's usually best practice. Any family history of sudden cardiac death or hypertrophic cardiomyopathy needs to be looked at a little bit more. Respiratory issues. So one common thing that I see is wheezing. I listen to the exam and they have wheezing, or they have a history of asthma, but they don't have an inhaler to use. So those would be reasons why I would want the student athlete to follow up to make sure that those conditions are well managed. Musculoskeletal is also a common reason. If a student athlete is under the care of an orthopedic surgeon, family medicine, sports medicine, for any type of injury, it is standard practice to clear them conditionally, meaning that otherwise medically they're cleared, but they must be cleared by whoever is overseeing the care of their injury before they are able to resume sports participation. And this includes anything from ankle sprains, broken bones, the works. Neurological. So one other common thing that we see in these sports PPEs is a history of concussions. So if a student athlete has had a concussion, they must be seen and cleared before they are able to resume playing sports. Usually you can talk to the student athlete and see how many they've had in the past, make sure that they have been cleared. And if so, and they don't have any residual effects and they've been cleared in the past, usually it's okay to clear them unless they have something currently ongoing. Other medical conditions, so things like uncontrolled diabetes, elevated blood pressure is actually a really common one. Chronic illnesses. So the most common thing I see within this category is one, acanthosis, finding the findings of skin changes on the exam. Now, I won't not clear a student athlete for acanthosis by itself, but it is definitely something that they need to be educated about and followed up with. For the elevated blood pressure, I will not clear an athlete until they are seen and followed up with to make sure that their blood pressure is stabilized and that they don't require any medications before they're allowed to play sports. And then failed vision test is also a really common reason why student athletes are not cleared. Basically, we can clear them medically, but they must be, it'll say clear conditionally, and then they have to follow up and get the optometrist to either look at their eyes for the first time or get them a new pair of glasses, increase their prescription for their glasses or contacts. And so that will be another option that we can do for the student athlete. So again, there's three types of decisions that can be made on the clearance status. The first is clear for participation. You can go ahead and do everything just as normal and document this to the student athlete. Let them know that everything looks good and that you can also give them some general advice over their health. Conditionally cleared means that everything looked good on their exam except for, and then fill in the blank. And within this category, you will need to fill in some specific instructions on follow up and when they would be allowed to be cleared. And also give the athlete good instruction as to how to complete that circle and make sure that that they are cleared to participate. The last section, which is actually the most rare clearance status that I ever do as a checkout provider, is not cleared. If you find something like they have a history of a hypertrophic cardiomyopathy, or they have something that's really prohibiting them from participating, you would put that you cannot clear them, and they would also be recommended to go back to either a pediatrician or whichever specialist they need to see if there's something that can be done about whatever condition they have so that they can eventually be cleared to play sports. Because we really do want these kiddos active. I mean, taking them out of sports completely is only going to make things worse from a standpoint of mental health, and social interaction, getting their exercise and things like that. So a few additional key points. So need to make sure we document really well, especially as a checkout provider. We need to understand the referral process, understand who are our referrals, who's the child's pediatrician. We also need to prioritize their safety. So, we might have the star quarterback. We find something that's wrong with their physical exam. We have to make sure that we treat them to the best of our ability and not take that into play. We don't want to prohibit our star quarterback from playing. Well, that's not the most important thing. The most important thing is the health and safety of the student athletes. It's, again, we're working as a team in these events, and so the feedback loop is super crucial. And then also the feedback loop with the student athlete and even their parents if necessary. So we all play a vital role in this process, and it's really important to know your roles and responsibilities and work well with each other. So that being said, we're going to take a moment to demonstrate what the typical checkout station would look like for the student athlete.
Welcome to the checkout station. This is the final step in the sports pre-participation physical exam, where we ensure all findings are reviewed and make the final decision on clearance. Today, we'll demonstrate a comprehensive checkout procedure. The checkout provider's role is crucial in verifying the documentation and determining if the athlete is fit to participate in sports. First, I'll review all the documentation from the various stations. This includes the general appearance, the EE&T, heart, lungs, abdomen, skin, and musculoskeletal assessments. I'm looking for any abnormalities noted by the PA students. For example, I'll check if there were any findings related to heart murmurs, respiratory issues, or musculoskeletal concerns. Hi, Ruby. I'll be doing a final review of your exam today. Do you have any concerns or any symptoms that you haven't mentioned yet?
No.
Okay, great. Let's go over your exam findings one more time, okay? So I'm looking over your history. I don't see anything noted here. All right, and second page, I can see that your vitals looked great, your visual acuity, your pupils, and all your physical exam items were also normal. Therefore, I am determining that it is safe for you to move forward with sports participation. If there were any abnormal findings, I would reassess those areas. For example, if a heart murmur was detected, I would listen to the heart again to confirm. I'm confirming that the initial findings are accurate. This is crucial for ensuring the athlete's safety. Additionally, I check for any signs that may have been missed or have developed since the initial exam. Based on the reassessment and review of the documentation, I'll now decide on clearance. In Ruby's case, all findings are normal. I'll clear her for participation in sports. If there were any concerns, I'd mark her as cleared after completing evaluation or rehabilitation for and provide recommendations for follow-up. I would also use this opportunity to educate the athlete on any wellness topics I feel are pertinent, such as healthy eating, healthy activity, decreasing screen time, and sugary drinks. I may also take the opportunity to discuss smoking, vaping, or chewing tobacco. Ruby, you are cleared to participate. You may now proceed, and if you have any concerns or any questions, please speak to your coach. Okay? This concludes the checkout procedure demonstration. It's essential to ensure all findings are thoroughly reviewed and the athlete is fit for participation. Thank you for watching.
All right, so some summary and key takeaways from this lecture. Let's go ahead and recap. We talked about the role of the checkout provider. We talked about how they have to take in all of the decision making with the history, physical exam, and come to the conclusion of whether the athlete is able to be cleared with some contingencies or not cleared. And it's really important for communication and education, and also making sure that we consider any ethical dilemmas within the process, and make sure that the conversation that we have with these student athletes is kept confidential. All right, so you will be asked to complete a post-test comprehension exam or quiz for section 4. So we'll have you do that next, and then after that we will go into section 5, which talks about practical tips and case studies, and the overview of the sports PPE tips, and we'll go through a few cases of findings and what we would recommend that we do in those situations. Again, if you have any questions, please shoot us an email, and we'll see you in the next section.